Many women complain about sperm leakage or sperm pouring out of their vagina after sex, and this leakage happens usually ranging from a few minutes to a few hours after sexual intercourse, and some infertile couples actually believe it to be the cause of their infertility. But now the question is, can sperm leakage or sperm pouring out of the vagina make it harder for a lady to get pregnant? Can it cause infertility? And if we may, what are some of the ways to stop or to reduce sperm leakage? Watch this video to the end to get the answers to these and more. Hello, my name is Dr. Malik Haruna King, and do well to subscribe to this YouTube channel for free health and wellness videos. Now let's dive straight in. Can semen leakage cause infertility? The answer is no. The leakage of sperm from the vagina does not cause infertility, although to a slight extent it can lower a couple's chances of conception if they have some form of subfertility or fertility challenges. Note also that sperm leakage from the vagina after sex is normal and to be expected when there is enough of the sperm ejaculate, because semen is liquid and so it is logical for it to flow out, especially when subjected to gravity. In fact, it can actually be a good thing for it to flow because it means the man ejaculates enough and may have good semen volume. It is important to note that most women notice some discharge immediately after sex, and some think it's the cause of infertility. Not exactly. The fluid coming out of the vagina after his orgasm is only a portion of the ejaculate, and less than 5% of the ejaculate is actually sperm. So over 95% of what you see is made up of other fluids which are not directly related to fertility, and so the leakage of the ejaculate from the vagina is highly unlikely to prevent you from getting pregnant. If he ejaculates deeply inside of you, then you can be sure that no matter how much of semen ejaculates leaks out afterwards, enough sperm cells will reach the womb. That is, if both of you are adequately fertile. Now, most times there are other causes of infertility in either the man or woman or both parties, and the sperm leakage is not the cause of the infertility. So if you are having challenges conceiving, don't merely attribute it to sperm leakage. Both of you must see a gynecology, and most importantly physically, for review and evaluation. But if you insist and you are asking what you can do to ensure that more semen stays inside after sexual intercourse, if you still feel you want more quantity to stay inside rather than flow out, then do this. Number one, use the doggy sex position. Now, for a woman, especially women with a retroverted uterus, the best position to adopt is the rear position or the doggy style. Now, this may help to deposit sperm deep inside, reduce sperm leakage, and increase your chances of conception. Number two, let her have an orgasm. Now, orgasm is usually accompanied by contraction of the pelvic muscles, which helps to pull sperm into the womb. Reaching orgasm and ejaculating increases a couple's chances of conception, even if sperm leakage still do occur. Number three, lay back after sexual intercourse. Now, to ensure adequate sperm enters into the womb and to minimize sperm leakages during sexual intercourse or after sexual intercourse, the female partner should place a pillow behind her waist and then remain on her back for at least 20 to 30 minutes without first rushing out to the bathroom to clean up. Number four, deepen penile penetration during orgasm. To further enhance the flow of sperm into the womb, the male partner will need to deepen his penetration, especially while releasing during orgasm. This will ensure that the sperm is ejaculated strategically around the entrance of the womb, increasing his chances of fertilization. Did you learn anything new today? Don't forget to hit the like button and stay subscribed, and check the description section for a free ebook titled Fire Your Doctor. Take charge of your health and happiness.